Now, away from that, the West African Center for Cell Biology of Infectious Pathogens has begun a training program for health personnel, particularly laboratory scientists. The center says that the initiative will provide skill and infrastructural training to the personnel. Mouse Numon has more in the following report.
In line with the Ghana Health Services Integrated Disease Surveillance and Response System in Ghana to strengthen disease surveillance in the country, the West Africa Center for Cell Biology of Infectious Pathogens, WACCBIP, has organized a capacity-building workshop on genomic sequencing for biomedical and medical laboratory scientists within the Ghana Health Service. Dr. Peter Kojokwashi is a research fellow and the deputy director in charge of research at the center. He tells JoyNews that training is basically aimed at building sequencing capacity.
Today's training is about building sequencing capacity in some facilities of the Ghana Health Service. It's to help us build sequencing capacity so that we can track, as we are tracking the virus in the country. You know, WACCBIP is one of the institutions that has been at the forefront of doing research on COVID. We also recognize and bring and build that capacity in the Ghana Health Service, because when you talk public health, you are talking about Ghana Health Service in Ghana. That's their responsibility. So it's a partnership between us, our funders, and the Ghana Health Service, and this is one of the first of many such trainings that we are going to organize for their facilities.
He explained that the participants will also be given the chance to try their hands on modern laboratory equipment and how to operate them.
This training is basically giving the biomedical scientists at 4 different Ghana Health Service facilities the ability to do sequencing of the virus. That is from sample preparation all the way to sample sequence deposition in the databases. And this will also be accompanied by some provision of instrumentation. So it's not just that they are going to learn the skills and not have the ability to implement it, but we will provide some of the sequencing machines there for them to do it.
Some participants who spoke to JoyNews said the training will equip them, especially in sampling and identifying variants.
With this program, I think it will be very useful for us to, at the local level, know which variants of COVID we are dealing with. And since the principle is pretty much the same with other pathogens, it will help us to be better prepared in case any other infectious disease surfaces.
It's actually to build our capacity at the end of the day to be able to quickly look at the various pathogens or the emerging or the re-emerging pathogens that come up with the various disease conditions, just so that we'll be able to give our support. We augment whatever the Noguchis and then the KCCRs and then the WACCBIPs are doing.
Coming from the marine science background, we all know there are lots of diseases or outbreaks that come from the oceans, a lot of pathogens here and there from the ocean, and I'm trying to understand the processes or in monitoring all of these organisms. Sequencing is part of it, so I'm here to build my skills in sequencing.
The training, which is also to strengthen the link between research, the government, and the health community, is funded by the Commonwealth Development Office of the United Kingdom through the British High Commission in Ghana. Mouse Numon's report for JoyNews.